And welcome to another edition of the NeuroOp Guru. I'm here with my good friend Drew Carey. Hi, Drew.
Hi, Andy.
And today we're going to be chatting about antiphospholipid antibody syndrome and a concurrent retinal vein occlusion with a homonymous hemianopsia from ischemic stroke. And so maybe, Drew, you could just give us a little background on this and why it might be important.
Yeah, there are not too many conditions that increase the risk for both venous occlusions and arteriolar occlusions. Our classic cause of stroke is going to be thromboembolic, right, from arteriovascular disease. Most of the hypercoagulability syndromes really increase the risk for venous occlusions, DVT, pulmonary embolism. Of course, if you had a cardiac shunt, you could have paradoxical embolism. But short of that, antiphospholipid antibody syndrome, other than vasculitis, is the big thing that puts you at risk for this for both of these conditions. And it's important to make that diagnosis because the treatment is very different. For arteriosclerosis and cholesterol buildup, you put patients on antiplatelet, but these patients need anticoagulation.
Independent of this particular case, you're saying that if you have both vein and artery, you would be thinking about antiphospholipid antibody from the start.
It's very high on the differential diagnosis, absolutely.
So maybe you could just tell the audience a little bit about what happened to this person.
Absolutely. So this patient is a 71-year-old female presented with painless visual field loss as well as left eye painless decrease in vision. And most of the time, if you're having a homonymous hemianopia from a stroke, your visual acuity is typically pretty well spared. So if you have somebody who comes in and you do confrontation visual fields, they have homonymous hemianopia, but they also have decreased visual acuity in one eye, there has to be a second process going on. So right away, that tips you off that this is more than just a CNS process, right? And more than just an eye process. This is an eye and CNS process. They had, as appropriate for their left homonymous hemianopia, their MRI scan, which did show their right PCA stroke as expected. And about a month later is when they developed the vision loss. And so they saw their eye doctor and they were found to have this vein occlusion. And you might on the surface say, well, hypertension increases your risk for vein occlusion and it increases your risk for things like stroke. So maybe that's, the underlying mechanism that gives you both of these. But when they happen that close to each other, you really also have to think, hey, could there be something else going on that's putting you at risk for developing multiple thrombotic events in different vascular beds, not only different vascular beds, but arteries and veins.
And who does this person need to see? Hematology, rheumatology, both?
I think it depends on who's comfortable seeing them. Antiphospholipid syndrome can certainly be a manifestation of a systemic autoimmune disease. It can be associated with conditions, most commonly lupus. Sometimes it's referred to as lupus antiphospholipid syndrome. If they have other systemic manifestations of autoimmune disease, then they definitely need to see a rheumatologist. But typically, the hematologist is going to be the one that is in charge of anticoagulation. But if they do have a systemic autoimmune condition, oftentimes these patients are at a minimum put on hydroxychloroquine because that also decreases their risk of thrombotic events and other systemic manifestations.
So, what do you think the take home message for our audience today is?
Yeah, big take home message. If you're seeing both arterial occlusions in the brain or in the eye and venous occlusions, you have to be thinking about more than just your typical vascular risk factors. You have to be thinking that either this patient has something like a hypercoagulability syndrome or they have a cardiac shunt, in which case they're going to need further workup. And you don't want to miss that because this is something that's treatable for preventing further strokes.
Thanks again, Dr. Carey. That's fantastic. This concludes yet another edition of the NeuroOp Guru. See you,
Thanks,
Drew.
Andy.